all our esteemed speakers, respected chairperson, and the enthusiastic participants. On behalf of Aarihant Ayurvedic Medical College and Research Institute, in association with GURUKUL Global Academy, I am honored to welcome you all for the national webinar on Panchakarma Beyond Hospital, a OPD-based practice from clinical industry in modern health. Panchakarma has long been recognized as the most powerful therapeutic approaches in Ayurveda, traditionally practiced in hospital settings. Today, it is expanding into new dimensions, especially in OPD-based care and industrial applications. This webinar aims to explore these evolving horizons and provide valuable insights into how Panchakarma can be effectively integrated into modern healthcare beyond conventional boundaries.
Excuse me, ma'am.
With us, Dr. Datt Bapardekar. He'll be the first speaker for today's session. He is going to address Panchakarma practices on OPD basis. A brief description or introduction about Datt Bapardekar is he is the founder of the Gurukul Academy. Also, he works as an associate professor in Department of Panchakarma at Sain Ayurvedic Medical College, Mumbai, Maharashtra. He has been practicing since 17 years and has delivered many lectures and also been awarded with many paper presentations. So I may request Datt Bapardekar sir to please carry forward with the first session. And to chair this person, we have Dr. Aniruddha Kulkarni sir. He is HOD and professor in Department of Panchakarma at Aarihant Ayurvedic Medical College. So may I request Datt Bapardekar sir to please carry forward with the first session.
Thank you, madam. So our today's first session is Panchakarma practices on OPD basis. I hope that I am well audible and visible.
Yes, sir, perfectly audible.
Yes, sir.
Just please share your slide.
Yes. We need to take blessings from Lord Dhanvantari and Sri Ganesh, and I start my today's lecture. There is a request to all. These are all my personal perspectives. So Ayurveda has its own opinion. So it is not like that someone says and another's opinion and my opinion may be differ. These are my personal aspects, and kindly ask me the questions after the live lecture. As you all know, the authentic standard Panchakarma, it has 5 elements which are Vaman, Virechan, Basti, Nasya and Raktamokshan. So what we do in these 5 procedures, we do Purva Karma, we do Pradhan Karma and we do Paschat Karma. Through the Purva Karma, we take all doshas to the Koshtha, and through the Koshtha, either from Vaman or Virechan, we expel it out through mouth or anus, and then we do the Paschat Karma. There is no need for Snehapan for Basti. Basti can do Shodhan, Bruhan, Shaman. Nasya is only for Jatrurdhva Vyadhi, and Raktamokshan whenever there is a Shakha Sthita dosh, means Tvak Raktadaya Maunsadaya Dhatavaha. Any Vyadhis related with this Shakha, we do Raktamokshan. So why there is a need for OPD Panchakarma procedures? It is convenient for patients. It is very cost effective, suitable for mild to moderate conditions and diseases. It is a non-invasive, minimal or no post-op care is needed, less time is consumed, and minimal clinic area is required. So what Panchakarma procedures on OPD basis we can do? In OPD basis, we can go for Raktamokshan. In Raktamokshan specifically, we can go for Siravedhan, Jalaukaucharan, Prachan, wet cupping and syringe. Also, we can go for a dry cupping. We can go for Viddha Karma, Agni Karma. We can do in OPD basis Sthanik Basti like Kati Basti, Manya Basti. We can do Nasya. We can do Matra Basti. In Sweden, we can do potali like Churna potali or Valuka potali. In dry heat, we can give Ruksha Swed like a infrared heat, Lep Chikitsa, foot massage Kansya Thali, and short Virechan, or we can call it as a Mrudu Virechan, that you can give in OPD basis. So let's start with the simple procedures. Here in picture you can see this procedure is called as a Kati Basti. Generally the patients with lumbago or lower back pain or sciatica, generally these patients we can do these Kati Basti procedures. There are two pictures, left and right. Left we can see that there is a dough made up of wheat and urad dal where we are pouring a medicated oil over that wheel. In right picture, you can see that there is a mold, and where mold, in that mold we are using the oil. So to keep the medicated heated oil over the period of say 30 minutes or 40 minutes, here we can easily do this procedure called as a Kati Basti. And it is very essential for elderly people, senior citizens, or any menopausal female patients. Here you can do, or any bike riders, such patients if may come to you, you can definitely do this procedure OPD level at your clinic. Same like a Kati Basti, you can perform Janu Basti. Here, no toilet is required, no washroom is required. Here, easily, same like a Kati Basti, you can perform here Janu Basti. So here you can see in left and right, without mold also, you can perform with the dough, we can perform this Janu Basti. Now coming to the basti, that is a basti pouch. Now ready-made available in market, disposable self-administered basti pouch is available. So what you have to do, as per your choice, say like a Dashmul tel, Tir tel, Dhanvantar tel, Sahachar tel, Narayan tel, Mahanarayan tel, Balatel, Kshir Balatel, as per your choice. In market, you can purchase a self-administered basti pouch. You can fill it up, and you can use, and you can give it to your patients to use at home, or you can give this matra basti at your clinic also. So there is a big opportunity that multiple uses, multiple choices you have in your clinic while giving the matra basti. Lep Chikitsa,
Amazing.
as you all know, we have medicated herbs, we add warm water, and we apply to the patient's area, which is diseased, say like a shoulder pain or lumbar pain, or you can say knee pain. So where you can give a lep chikitsa, you can bandage it with roller bandage, and you can send your patient to home. So this is as simple as that. These three procedures you can easily do at your clinic. Now coming to the Swedan, as you all know, Stambha Gaurava Shitagnam Swedanam Swedakarakam. Whenever there is a rigidity, stiffness, heaviness, you can perform Swedan procedures. So these are the Swedan procedures: Patra Potali, Churna Potali, Valuka Potali, Jambir Potali, Mounts Swed, Dhara, Bashpa Swed, Nadi Swed, and Ruksha Swed. Out of that, you can perform in your clinic Churna Potali, you can perform Valuka Potali, and you can perform infrared heating lamp, that is a Ruksha Swed. Now coming to the Valuka Potali, it is also called as a Manalakiji. So it is a Sagni Pinda Swed and it is a Ruksha Swed. It can be done on a particular part, or you can do as a whole body. So it is a Ekanga and Sarvanga you can use. There is a no need for Abhyanga, but you can do with Abhyanga. If you want to do with Abhyanga, local Abhyanga, you can perform it with Sarshap oil, and then you can go for a Valuka Potali Swed, or you can dip in Dhanyamla, that is a Kanji, that is a optional. So what is the procedure? You have to just heat it Valu, keep it in the cloth, make it potli, make it as a bolus, and keep on the patient's area. So whenever there is a stiffness, swelling, localized swelling, pain, you can perform this Valuka Potali swell. Either you can do one thing also, ki you can prepare this Valuka potli and you can give it to your patient and can say that just heat on a pan and you can perform your own at your home also. So this procedure of Valuka potli Swedan can be done at home also and at your clinic also. Next is Churna Potali, Podigiji. This is also Sagni Sankar Swedan. It is a Sasneha or Rukshan. These are all two types. If we dip Churna Potali into the oil and then if we are using, it is called as a Sasneha Swedan. If without dipping in the oil, we are directly applying on the patient's part, it is called as a Ruksha Swedan. So as for the Valuka Putli, you can do on a specific part, on a specific joint, say like on knee or lumbar area or shoulder area, or you can perform generalized, that is Sarvanga Swedan also can be done. Where you can do, as I said, whenever there is a Stambha, Gaurava, Shita, you can perform this Churna Potali. Which Churna we can use? Just have a look. So in the market, there is a Kottam Chukkadi Churna. This you can use or you can choose Kola Kulathadi Churna. So either both of them you can use or mix it with the Valu also and you can give it to your patient or you can use at your clinic also. Now, third Sweden type is infrared lamp. So what is infrared lamp? Generally, it is used in physiotherapy clinic, but it is a very safe procedure. Under Ayurveda, it is called as a Ruksha Swed. It is excellent in Margavrojanya Samprapti or polyarthralgia. A patient comes with to you, RA report is negative, but ANA is positive, CRP is raised, and patient is coming with polyarthralgia, where you can use this infrared lamp. So it is used in a Sam Avastha whenever there is a muscular spasm, local inflammation, like a sprain, amvat, sports injury, you can use this infrared lamp. Now I am showing one video where they are saying that it is very easy infrared lamp using and you can perform at your home also and at your clinic also. Just have a look at this video.
Even the slightest muscle ache or joint pain can put a damper on an active lifestyle. But how can you get rid of these aches and pains quickly? The innovative Philips infrared product range exists out of the InfraFill and the InfraCare, with which you will experience substantial and effective pain relief. The deep penetrating warmth of InfraFill's and InfraCare's powerful and innovative infrared technology relieves temporary and persistent aches and pains. The comfortable warmth penetrates deep into your skin, stimulates blood circulation, and relaxes your muscles. This helps your body get rid of waste products and quickly sends oxygen-rich blood to stressed areas, bringing effective pain relief. InfraFill and InfraCare have been certified as a medical device in accordance with the European Medical Device Directive and are backed by clinical research. Clinically proven to relieve muscular and joint pain, infrared light is used by professionals to relieve pain. Philips has been a leading expert in innovative infrared technology for over 50 years.
So as we say, and as we could see that infrared you can easily keep at your clinic and you can use it. Now next we are moving to the Siravedan procedure. As you can see here that on dorsum of the foot we have applied IV set and we are withdrawing the blood. So this procedure is called as a Siravedan. Whenever there is a systemic disease, so any systemic disease, you can go for a Siravedan. What you have to do, you have to give 3 days fixed amount of Grutapan to that patient on early morning, empty stomach. And on fourth day, during the Pittakal, you can go for a Siravedan. As you can see in this picture, left picture, tourniquet is applied and IV set is applied. And in the kidney tray, we are withdrawing the blood. If in right picture, you can see that there is a thin part and there is a dark part. So this is a dosha vilodit karan. It is because of snehapan. Hence, for Siravedan, prior 3 days, snehapan is required. So whenever patient comes with you with a varicose veins, or sometimes it may comes with the complications of varicose veins, like a varicose ulcer. So here you have to perform the Siravedan. So during this procedure, if patient is of varicose veins, you have to make the patient stand, and from the posterior aspect, you have to withdraw the blood through the needle. So in this procedure, left side, you can see that patient is standing, and right picture, you can see that needle is applied through the IV site, and in the kidney tray, we are getting the blood. Now, another very simple method for withdrawing the blood, that is Rakta Mokshan, is syringe method, where localized bloodletting we can perform. So 2 cc syringe or 5 cc syringe or 10 cc syringe, disposable syringe you have to do, you have to take, and needle we require. So what you have to do, prior you have to do that, make a sharp cut towards the needle nozzle end. As you can see in this right picture, that we have cut the sharp needle nozzle end, and then we have applied a piston upwards, so vacuum is created, and just to make the vacuum on that area, we have put a needle through its piston. So vacuum is created, and in such patients like plantar fasciitis and calcaneal spur, we can perform this syringe method bloodletting procedure. Now we are moving to the Jalaukav Charan procedure. In many clinics and OPD level also, these procedures can be done. As you all know, Jalaukav Charan or leech therapy, minimal it takes 30 minutes, or maximum it can take 1 to 2 hours. So if suppose patient is with small area of eczema or psoriasis or vitiligo, definitely you can perform this procedure at your clinic. What you have to do, that just take a look at the SOP of the Jalaukav Charan. Take a fresh leech from water container, clean the surface of the skin of the patient, apply leech over the skin, cover the body of the leech with wet cotton. As soon as it attaches with the patient's body, you have to cover the body of leech with wet cotton. And as soon as it detaches, you have to apply turmeric powder over the mouth of leech also, and over the wound of the patient also. So this is the simple procedure of Jalaukav Charan. What we require during this procedure, we need leech, we need 2 bottles, we require cotton, roller bandage, kidney tray, plastic sheet, gloves, needle, haridra, micropore, scissor, spirit, hand sanitizer, and shatadhaut. Why spirit is needed? So if suppose 1 hour is passed and your patient's leeches are detaches, so it may get dry up. So to just to remove the staining of the dry blood, we have to apply spirit. But just make sure that you should not apply spirit over the wound directly. Now, what observation we receive, that leech doesn't like hairy part. So if you are applying over some area when there is a lot of hairs are there, you have to remove that hairs 2 days before. Leech doesn't like strong smells, odors, or chemicals or ointments that has used before. So suppose if your patient is of gout arthritis and the patient has applied any lap just 2, 3, 4 hours before, so or due to that odor, your leech won't attach. So make sure that minimum 24 hours, no such local application prior to the leech is required. Anticoagulants should be withheld at least 3 days prior, like Ecosprin, aspirin, such tablets. You have to stop for 3 days. After the procedure, residue mark appears like which looks like a Mercedes logo, which will disappear in next 3 weeks. Leech secretes jelly-like liquid around it while sucking the area, and it keeps sticking or bandaging at least for next 6 hours. Why it is said that sometimes it can bleed again. So make your bandage and keep it for next 6 hours. Where you can apply such leeches, you can apply leech on skin, wound, abscess, mouth cavity, eyelids, hemorrhoid mass, genitals, and scalp. Now, here is the inflamed wound. This patient is of unknown poisonous bite patient, where he was not aware that which insect came and bite him, but that inflamed, and after say like after 24-48 hours, patient came to us and we immediately applied leech in the clinic. In right upper picture, you can see that it looks like a bright red color, and immediately after the leech detaches from this patient, it died. So whenever there is a poisonous insect bite of unknown origin, the generally leeches, as soon as it detaches from the patient's body, it dies. So this is a one observation also. Definitely, you can apply leech on the lips. In this patient is of vitiligo, and vitiligo patch was over the lower lips. Hence, we had used leech on the lips. As I said that leech doesn't like hairy parts, so 2 days before we have shaved. This is a patient of abscess or vidradi, where we had applied the leeches. Sometimes patient may come with you on non-diabetic, non-healing open wound. So on open wound also you can definitely apply the leeches. This is a Indralupta where the some part of the area of the scalp is devoid of the hairs. So in such patients also you have to use leech procedures. Here in left you can see that Indralupta area, that is a part of the hair which is with no hairs. We had applied 4 to 5 times leeches, and in right side you can see that there is a regrowth of the normal hairs. Definitely, you can also use leeches on the tongue, definitely, and it is very safe. There is a no prolonged bleeding you can see in the tongue area. As soon as you leech detaches, the bleeding stops. So, what is the mode of action of this leech? So, Granthakar says that whenever you give to the swan milk mixed with the water, it will drink only milk but not the water. Same as a leech, it will drink only vitiated blood but not the normal blood. So here you can see that this is a patient of eczema on the foot part, and we had applied a leech in these procedures. But make sure that your leech procedures, as the disease is very chronic, you have to apply and you have to give sittings of leech procedure or Jalaukav at least 4 to 5 times. Next procedure that you can do at your OPD clinic, that is a Virechan. You can give a Snehapan that can take patient at home as per your directions and instructions. Then after that, on the Virechan day, patient can take Virechan tablet as per your advice, and he can be connected with you through WhatsApp messages or call if needed. And such a Virechan procedure also, or we can say Mrudu Shodhan or Mrudu Virechan, that can also be done at OPD level. Charak, this shlok is from Charak Kalpasthan 12th chapter. This avastha is durbalo api mahadosho virecho bahusho alpashaha mrudubihi beshajaha dosha. It means when the amount of morbid doshas are high in a weak person, then doshas can be eliminated by repeated administration of mild drugs of virechan. Suppose you have the patient of ascites or udar, where doshas are stagnated inside the adhokoshta. So where you have to give repeated virechan, as the bala of vyadhi is uttam, but the rugna bal is hin. So definitely you can give such kind of virechan repeatedly to the patients. Now just have a look at this testimonial of this patient.
ऑडिट करून वाफ घेतल्यानंतर मला अग्निकर्म ट्रीटमेंट दिली. अग्निकर्माच्या ट्रीटमेंट नंतर मला चालताना चेहरे करताना मला खूप रिलीफ मिळाला आणि त्याची भीती वाटली चालताना फार चालता येते की नाही करताना but I'm getting relief from the pain very fast.
So what patient said, the last sentence was getting relief from the pain very fast. So what is the procedures we had done? The patient just said that Agni Karma. So just take a look of Agni Karma and Vidya Karma together first. It is a OPD-based procedures. Agni Karma and Vidya Karma you can do at the OPD level. No need of Panchakarma setup. Can be performed in your consulting room. Less equipments are required. More benefit, simple procedure, OPD level, anytime you can do, anywhere you can do. So what is the procedure? Agni Karma, it is like a micro cautery. We hit the shalakas and we keep on the patient's body part, and with the help of shalaka, we achieve Agni Karma. So what is a Vidya Karma? We take a simple hollow needle and we puncture the body part, and this is called simple as Vidya Karma. This is a collective indication of Agni Karma and Vidya Karma where we can use in neuromuscular disorders, musculoskeletal disorders, degenerative joint disorders, arthritis, frozen shoulder, trigger finger, post-fracture residual pain, calcaneal spur, and corn. Ankylosing spondylitis, rheumatoid arthritis, colic abdominal pain, sprains and strains, sinusitis, bursitis, mouth ulcer, and many, many more. So where to use Agni Karma and where to use Vidya Karma whenever pain is subjected. So whenever there is a localized pain, you can go for Agni Karma. Whenever the pain is generalized, then you can go for Vidya Karma. What Agni Karma and Vidya Karma reduces? It reduces pain, inflammation, stiffness, immobility, and jerk. What Agni Karma and Vidya Karma increases is increases tissue metabolism. It increases local blood circulation, stimulation of regional nerves, stimulation of local inflammatory responses, and muscle relaxations. So now take a look of Agni Karma first. So as I said, it is a non-invasive thermal microcautery procedure where heat is conducted through a metal or non-metal rod. We call it as a shalaka, known as a Agni Karma procedure. Specifically, I use for pain and stiffness. What the drugs will not cure, the knife will cure. What the knife will not cure, the cautery will cure. What the cautery will not cure must be considered incurable. So this is a word of Hippocratic that it says that Agni Karma is very, very, very much important. So now we will look at indications for Agni Karma in pain management. So specifically which part or which area is covered? Neuromuscular joints like osteoarthritis or rheumatoid arthritis pain, muscle pull, sprain, spasm, entity like tendon, ligaments, bursa, fascia, bone, history of chronic trauma or post-surgical any complications, you can go for Agni Karma. What we require? We require Shalaka for Agni Karma. We require gas burner, forceps, candle with matchbox, Shatadhaut, Ghruta tube, pain or fine marker, and cotton we require. So there are different types of Shalaka. As we said that metal rod, we call it as a Shalaka and we use it for Agni Karma. So there are n number of Shalakas available in the market, or you can make yourself also with the jeweler shop. Suvarna Shalaka, Raupya Shalaka, Loha Shalaka, Tamra Shalaka, Mrittika Shalaka, and Panchadhatu Shalaka. These are the Shalakas now you can use in your clinic. So this is my personal Shalaka. The smaller upper one is a gold Shalaka, Suvarna Shalaka. It is a 21 carat and 8 gram Shalaka. And the lower bigger one is a Raupya Shalaka. So these definitely you can use in your clinic. This is a Mrittika Shalaka made up of soil and it is specifically used for calcaneal spur. Now this is Loha Shalaka and Tamra Shalaka. It is a like microsurgery procedures where like a corn, you can use this Loha and Tamra Shalaka. So what are the different indications as per the Shalaka? Just take a look. Suvarna and Raupya Shalaka, whenever there is a superficial entities, like a patient is saying that I had a sprain or frozen shoulder, some kind of superficial entity. Deep entities like corn, we can use for Loha Shalaka and Tamra Shalaka. For general pain, you can use Panchadhatu Shalaka. And as I said, for specifically for calcaneal spur, you can use soil Shalaka, that is Mrittika Shalaka. Now, there are two major methods. First is direct Agni Karma and second is indirect Agni Karma. There are, other than Shalaka, we can use Agni Karma through Pippali, Gud, Bhallatak also. But generally in clinic, we use Shalaka either from direct method or indirect method. So what are the SOP of Agni Karma procedure? First of all, find the most tenderness point over the joint or the body part and mark it with the help of pen. Now, there are two methods, as I said. In direct method, we heat the shalaka on fire and we directly apply on the marked point over the body part. That is called direct method. Indirect, we keep shalaka first on the marked point and the opposite end of the shalaka, we heat it with the candle. So this conduction method is also called as an indirect method. After the desired temperature is achieved, we apply ghee or honey over the Agni Karma point. Now in this video, you can see this is the direct method of Agni Karma. So this is a direct method of Agni Karma. What we require, as I said, that forceps we need Shalaka. So this is a gold Shalaka, candle, matchbox and honey, either honey or ghee. So here you can see that first of all, you have to make sure that you have to mark over the most tender point.
ये क्या है हाँ ये बात है जैसे ये पूरा ये पकड़े हाँ ये हाँ
So after marking the most tenderness point, we will do the Agni Karma procedure. So this is a indirect method or conduction method.
जरा मुझको एक बार मुझे हो गया जल्दी अपना काम हो जाए
So as you can see that I am doing this procedure in my OPD only. As the desired temperature is achieved, you can pick another point of tenderness. Now, this is the second case of cervical spondylosis patient. Patient was complaining of neck pain and stiffness.
थोड़ा गर्म लगेगा के बाद गर्म चटका लग रहा है ऐसा लगेगा तो बोल दो मैं निकाल लूंगा
So if you can see, we had already marked the most tenderness point with the help of pen. And parallelly, we are applying the heat with the help of gold shellac. After that, as I said, you can apply either ghee or honey over the point of Agni Karma done. Now, case 3, a female patient of 46 years. She was complaining of right wrist joint pain and stiffness since 4 months. There was no history of trauma. Patient was diagnosed as a dequervant tenosynovitis and patient was advised for surgery. So what is dequervant tenosynovitis? As you can see that there is a fine sheath over the tendons which inflames, and there is a issue with the thumb and index finger while performing or holding any procedure. So this is a reports of that patient, and patient was advised for a surgery. So in right picture, you can see that on the upper part of the thumb, uh, in wrist area, we had performed the Agni Karma, and patient was very happy after 6 to 7 sittings of the Agni Karma with gold shalaka. Patient was happy as there was no mark after the Agni Karma procedures, and patient was more happy as she could avoid the surgery. So after the surgery, patient was aware that there are chances of keloids, so post surgery complications. So she was very happy that she could avoid the surgery, and the expenses was also very less as compared to the surgery. Now, another findings we see in our clinics is trigger finger. What is trigger finger? It is like a flexor tendons of the index finger with pulley holding them in the place, an inflammatory trigger nodule we found in the flexor aspects of the hand. Generally, it is a flexed and patient gets pain at the base of the phalanxes or metacarpal. So in such patients, if you can see in the picture, there is a tendon nodule. So as per our Ayurveda, we can compare it with Medoja Granthi, and direct Agni Karma over that tendon nodule is achieved and patient gets relief from the trigger finger. Differential diagnoses are sometimes gout patients or rheumatoid arthritis patients or osteoarthritis patients also can come with trigger finger. So as I said that you have to apply direct method Agni Karma procedure on that nodule, and after say 3 to 4 sittings, patients get 90 to 100% result in trigger finger. As I said, a Mruttika Shalaka we can use for calcareal spur. Sometimes patient may come with Achilles tendonitis, and sometimes patient may come with plantar fasciitis. But in some patients, you can get all these three observations. Like patient is having calcareal spur also, Achilles tendonitis also, and plantar fasciitis also. So as I said, for Achilles tendon, for calcareal spur, we use Mruttika Shalaka. But for Achilles tendonitis and plantar fasciitis, we use gold or silver Shalaka. What are the contraindications for Agni Karma? We cannot use in Pittaj or Raktaj Vyadhi. We cannot use Agni Karma in gout arthritis or bulky localized swelling. We cannot use the Agni Karma. Now moving to the next procedure, that is a Viddha Karma. As you all know that puncturing is simple way is called as a Viddha Karma. What we require is 26.5 needle, spirit, pain or fine marker, cotton, kidney tray and gloves. So what are the SOPs of the Viddha Karma? Just first of all, find out the most tenderness point, mark it with the pen, and just prick with the 26.5 needle. So as simple as that. First of all, as soon as you mark the point, just clean it with the spirit and then use Viddha Karma with the help of 26.5 needle. So what are the contraindications of Viddha Karma? If it is a mixed infected area, you should not use the Viddha Karma, or any pus area or any major swelling is there. Generally, avoid Viddha Karma procedures. What are the probable complications of Viddha Karma? Local thrombosis and excess bleeding can happen. What are the benefits of the Viddha Karma? It is the simplest form of Rakta Mokshan. It is a OPD-based procedure. Instant pain relief you can get from this procedure. It is a very cost effective, no post-op care is required. Simple procedure, less time is consumed and can be performed anytime. So here I finish with my lecture. I express my gratitude towards my mentor, Dr. R.B. Gokte sir, from which I learned Agni Karma and Viddha Karma. Thank you.
Thank you, sir. Thank you so much for the insightful and very practical oriented session. The session is open for question and answers. I think I have few questions. Dr. Nidhi ma'am has asked, is Rakta Mokshan effective in vitiligo or lower lips if the patient has history of approx 10 years? Sir, can you please address this question?
So in cases of vitiligo, you can go for weight cupping procedure. Weight cupping is more effective, or if it is less than say a 10 rupees coin, you can go for leech procedure. So either you can go for weight cupping or you can go for leech procedure for such patients. Thank you.
I think Nidhi ma'am must be satisfied with this answer. So we have one more question. I request Ms. Dr. Monica Wade please to address her question again. Please unmute yourself and put forward your question. Monica.
Uh, Hello.
Yeah, Monica ma'am, please.
Mm. Sir, when we do Agni Karma, when we place Suvarna Shalaka or Dhatu Shalaka at one point, and then we remove that Shalaka after giving Agni Karma, and we keep the Shalaka at other point, it is already hot. That time the patient cannot sustain that burn. So what to do? Should
Yes,
we wait for
yes,
some
yes,
time?
yes. No, no. I just answer it. So this is a practical question. So suppose there are 10 points over the body part, and we are using, I think, direct method, right? So in direct method or indirect method, first of all, in direct method, we just hit the shalaka and apply. Okay. Again, we hit and apply. But here we give minimal pressure over the body part. But in the case of indirect method, like suppose we are holding the shalaka over the patient's body and we are hitting another end with the candle. Okay. The question is, as soon as the shalaka hits up more on the second point, patient may get irritated. So what you can do that after the shalaka gets heated, you can rub it little on over your hand or on
Hmm.
a Turkish towel, and then again you apply in indirect method to the second part of second point of tenderness. So these are the practical procedures. As soon as you will do the more and more Agni Karma, you will learn more and more practical procedures. So as I said that after first tenderness point Agni Karma is done, just place that shalaka over your hand, or you can apply over the Turkish towel, and you can use for next tenderness point.
Okay, sir. Thank you.
Thank you. Thank you.
Another question we have from Arpita. Ma'am, can you please address your question? Arpita, ma'am. Arpita, ma'am. I think she's currently not available. So we have one. Yeah, Arpita, ma'am. Please carry on.
जळू कोणत्या कोणत्या
Yeah,
कंडिशन्स मध्ये
Arpita, ma'am.
जळू कोणत्या कोणत्या कंडिशन्स मध्ये टंगला अप्लाय करू शकतो? थँक्यू.
Yes, yes, yes. In Sanhita, you can say that Sarvasar Mukhapak is a condition where you can apply the leech directly on the tongue. So then, whenever there is a Sannipataj Vyadi, you can apply leech on the tongue. That patient, which I showed, was CA tongue patient, but the report was waiting. So for that waiting period, we had used leech procedures in CA tongue. But if suppose repeated mouth ulcers are there, so instead of leech procedure, you can go for with the Karma procedures.
We have one more question from Ayush Pragya. Please put forward your question. Please, how to know the exact points for it? I think this question is related to Agni Karma, I guess. How to know the exact points for it?
Okay, so for Agni Karma, as I said, most tender point, whenever patient can show you the pinpoint, tenderness point, where you can do the Agni Karma. If patient is saying gross, generalized, means whole hand is paining, then you can do the Vidya Karma procedure points. What are the Vidya Karma points? In Ashtang Sangra or Ashtang Hriday, there is a Vidya Karma points or Rakta Mokshan points where you can do the Vidya Karma. Like suppose there is a Vata Rakta or Chippa or Vata Kantak. So Granthakar has said on the dorsum of the foot, 2 fingers above the Kshipra Marma, you can go for a Rakta Mokshan. So instead of Rakta Mokshan, you can do Vidya Karma. So such different points are described in our Samhitas. So for colic pain, there are different area. For sinusitis or rhinitis, there is a different area for the Vidya Karma. So these all our points are enlisted in our Samhita.
Uh, I think this will be the last question. 58-year female with varicose vein and on blood thinners. How to do Jaloka Avcharan in this case? Is it indicated or contraindicated? 58
If
years female with varicose vein on blood thinner.
If patient is very obese, you should and on anticoagulant medicines, you can avoid the leech procedure. Obese means you can say more than 100 kg. It may vary from 100 kg to 150 kg. You should avoid the leeches. But it is a primary avastha of the varicose veins. You can definitely apply the leeches. If suppose patient is on anticoagulants, you can go for a Siravet directly. If patient is obese and on anticoagulant drugs, you can directly go for a Siravedhan. But just make sure that whenever there is a tortuous vein, you should not puncture there. You can go either upper or lower that tortuous vein and you can puncture that vein. Okay, if you by mistakenly puncture that tortuous vein, so there is a very difficult to stop the bleeding. Hence, and the patient is obese, so there may be more difficulty in stopping the bleeding. So, as I said, on tortuous vein, not directly puncture that vein on that patient, either upper or lower. You can puncture the vein through the Raktamokshan or Siraviram.
I think we are done with the questions. Thank you so much, sir, Dr. Bapardekar, sir, for this enlightening session. Now, may I request the director of Aarihant Ayurvedic Medical College and Institute, Research Institute, Dr. Rakesh Salve, sir, to please address this session with his insightful thoughts. Rakesh, sir.
Yes, madam. Good morning, everybody. First of all, on the behalf of Aarihant Ayurvedic Medical College and Research Institute, I thank Dr. Datt Bapardekar sir from Gurukul Global Academy. He's also working as an associate professor at Ayurveda Mahavidyalaya Sayan. Sir, your lecture was thought-provoking as well as practically based. You showed quite a lot of photos, videos, which would definitely help our more than 120 participants who are hearing you right now. Uh, some things which I personally liked were that you showed the some cases where you practically told us the leeches died after Rakta Moksha. That is something which only a person can tell who is practically doing the karmas on a regular basis and which is generally not shared on commonly. Second, you also uh, enlightened us with different kinds of shalakas, of course, and specifically where different shalakas can be used in different indications. Your video demonstrated also the direct as well as indirect Agni karmas. One more thing which we generally as speakers or resource person avoid ki we don't go into contraindications and complications of our procedures. But thank you, sir. You definitely told that also in case of Vidya karmas ki where the Vidya karma should not be done. They are contraindicated as well as some complication may also arise if you do in those conditions. So Once again, on the behalf of Swarnim Startup and Innovation University, I thank you. And it would be wrong if I don't thank my own department of Panchakarma, right from the HOD, Dr. Anvita Kulkarni sir, Dr. Akshaya madam, Dr. Hetal madam, as well as Dr. Girish for organizing such a wonderful seminar. I hope this seminar is informative and it will run for, I think, 1 or 2 hours more. I thank all the participants also, and thank you, sir. Thank you for your lectures.
Thank you, sir, for kind words and appreciation. Thank you.
Thank you, Rakesh sir. Thank you so much. Now may I request HOD of our department, Dr. Aniruddha Kulkarni sir, to please address this session in short.
Hello, this is Dr. Aniruddha Kulkarni, chairperson for this session. Thank you very much, Dr. Bapardekar sir from Gurukul Academy. I know sir since last 15 years or so. We may have worked together for a little while also. It was a wonderful session with nice pictorial presentations of especially Jalo Kavchar and Vidya and Agni Karma. It was a privilege to have you here, sir, and I really hope for many such presentation in future. Thank you very much, sir.
Thank you so much, sir. Now moving forward to the next session.